That was terrific, and we're going to have some time for discussion. But the first thing, before that, I'd like to recognize Jennifer. Jennifer is, oh, there, okay. Jennifer is here from Hunter College, and she was delayed, and we're happy she's here to say a few words. Jennifer Rabb is president of Hunter College. So thank you.
Thank you so much, Debbie, for being here. I was out looking for your breakfast, and I did not find it. So I am very and I hate to do that as a Jewish mother. I hate to arrive without food, but I'm very grateful for your being here, Debbie, and to the IOM and to Jim Nickman and our partners at the New York State Health Foundation. We're so happy to host this morning, but most importantly, we're really excited about the conference and asking you to help partner with our initiative here. So I'm very grateful for the opportunity to step back and just give a little framework of what Hunter College is working to do in East Harlem, and which very much intersects with the issues on your agenda today about scaling and spreading the impact of evidence-based research. So, picture's worth 1,000 words. You're in a beautiful building, and it was wonderful for me as an institutional leader to actually have the experience of having architects listen to you when you have a vision. And we asked the architects when we were planning this building to create a structure that was inviting the neighborhood in. And that's what you'll see now if you walk through again. You'll see it's about glass. The first floor has this long hall that we call sort of the inside street, and it's really worked in engaging the neighborhood. But it's obviously not about architecture, as beautiful as it is. It's really about a vision we had of moving our School of Social Work here, of then co-locating our School of Public Health, which had been all the way downtown, and then reaching out past these two schools to the other parts of Hunter College and CUNY to ask that question that I know many of you think of in your work. Can an academic institution move into a neighborhood with extraordinary challenges and actually get it right? And that is the experiment that we are embarking on. It was a very purposeful move here, and a 2-second sort of interesting kind of philanthropic institutional backstory. The School of Social Work, which many of you may have visited years ago, is on 79th Street in one of the wealthiest neighborhoods in New York City. And it was actually built for us by a very interesting philanthropist who visited Puerto Rico as his business was in tobacco. And he was very taken by a social worker there who talked to him about the importance of training social workers, particularly in public schools. And he came back from that trip and in 1970 made a gift of first his own brownstone on 79th Street and then the one next door that he bought. He tore both of them down and built us a building on 79th Street for our School of Social Work, which then became a school. It had been a program and opened in 1970. And you can see the outside, there's a little exhibit of showing these buildings. And it was his vision to invest in Hunter and CUNY to train more social workers. The amazing thing is that the social worker in Puerto Rico is actually one of Hunter's most extraordinary graduates, a woman named Antonia Pantoja, who many of you may know started the incredible organization Aspira to really empower Puerto Rican youth in New York City. So it was a great coming together. But years later, we started to really outgrow this building and to say, is that the best place in New York City to have a social work school on 79th Street? And we were able, through a very interesting real estate swap, to take that property and have a private developer build us this extraordinary building, which actually got done because it wasn't done through our public system. So it got done very quickly, very efficiently. And then we came back to that question. We didn't just move to this neighborhood. We moved to this neighborhood as a neighbor and as a catalyst. And the question, as I said, is we posed to ourselves, can we move to a neighborhood with some of the worst health indicators in the country, some of the worst social and economic backgrounds, some of the most challenging educational statistics, and actually make a difference? And for the City University, for Hunter College, we came in with goodwill. There's a lot of, we're not an institution in New York that's looked upon as somebody who's like an outsider. We are community-based. We feel right to the community. But nonetheless, we got many of the questions as we were planning the building. Are you going to just come here and study us, and then we never get any of the results of this incredible research you're doing? And it was very clearly articulated. So we set apart that challenge out to ourselves to say, no, we are going to actually try to get this right. And the first question is, what do we mean by sort of trying to actually improve a neighborhood, to create a neighborhood that that we help make healthier, better socially secure, and better educated? So we're still in the process through very sophisticated GIS scholars that we have at Hunter in actually defining what is East Harlem and what is this neighborhood we're talking about, and also defining what is the time period that we're setting forth to ourselves to measure success. Is it 15 years, 20 years? How are we going to measure that timeline? But the parameters of a project we're now calling All in East Harlem is a challenge that I have put out to all of the faculty, to the faculty in this building, where we have extraordinary public health researchers. Many of you know them. We're doing work in such a variety of areas, from food policy to environmental work through asthma and diabetes impact. We have an incredible School of Social Work. I know you're going to hear from Dan Herman later today. But we have an incredible School of Education. We're not based here. We've brought them up here. We've asked them to integrate into the schools, our schools of nursing. We've gone to our School of Arts and Science, to our psychology, to our urban planning, to our sociologists, and asked, where is the research you're doing? Can you focus it on East Harlem? Can you partner with your fellow colleagues to talk about the impact? Because you're working on so many of the same population groups. And then we've gone in a more creative way. One of the things we learned from the community, because we've started with the community, we've had a number of sessions in this room over this summer asking the community, what are your needs, before we come in and tell you what they are. And a lot of it, we've heard a lot of things about just wanting art in the neighborhood, a more beautiful environment, which we believe has an impact and interacts with some of the harder science. So we brought in our art department. And we're putting out this challenge. Can we focus our research on the neighborhood? Can we work together as scientists to talk about impact? And also, can we focus the training we're doing? Because we have hundreds of social work students coming through these doors every day, and public health students, and then our student teachers. And can we bring the future workforce of the city and focus them? And then, of course, as an undergraduate institution, we have just an army of really well-meaning young people who want to make a difference. So we're trying to increase the volunteerism among our undergraduate population and link them with both the academic and social projects that are coming out of Hunter College. And that is the challenge that we have now placed in front of ourselves. Can we engage in this community? Can we be a true community partner? Can we listen to the objectives? Can we focus our research? And really make it have a multiplier effect by talking to each other. And even just in this building, one of the theories, when you see the big steps that we put in, the concept was that social workers and public health faculty and students would have to kind of bump into each other and sit on the steps together. And I know for the first 3 months there was nobody sitting on the steps, and it was very sad to me. And I finally found out the guards, every time someone sat down, the guards actually told them to stand up. So, you learn how you just have to keep reinforcing a message. But the hope is that to put two academic disciplines that have so much overlap and sometimes don't even know it in a building, but also bring in all the resources and have this institutional challenge that I speak about all the time, that I've diverted resources to, that I'm trying to put my money where my mouth is, to say we are challenging ourselves as a premier academic institution to come into a neighborhood that is highly challenged in so many respects, and to set a goal for ourselves and to say, can we make a difference? And I'm so really just grateful that you're here today doing the important work that you're doing. I'd leave you with this question: can you help us? Because this is an experiment I think we're all invested in, because if we can get it right at Hunter College here, then so many of your own institutions, you will be able to learn as well from this model. So we invite you to help us learn and to really concentrate on this goal of making a difference in an institution that obviously our heart's in the right place, but can we strategically have an impact that people then say it was to benefit to this community that Hunter College moved here 10, 15, 20 years ago. So I thank you for all the incredibly important work and the contributions you're making, for being with us today, and to have me have the opportunity to welcome you here. Thank you so much, Debbie.